Ms. Ross. My name is Therese Rossi. I'm a nurse practitioner student and I'll be assessing you today. Are you comfortable?
Yes.
Good. Patient's mood is not depressed. Her affect is not flat. Her demeanor is not agitated. She is cooperative and alert. Her dress is appropriate for my assessment today. Her hygiene is intact. She's 127 pounds. She's 65 inches tall. She is a BMI of 19. Her stature is upright and she appears to be well nourished. So now I'm going to start with my skin assessment. So skin is normal for ethnicity. Normal for ethnicity. There's no changes in her skin color. There's no yellowing of her skin. Her skin is intact and her texture is smooth to touch. No rashes, lesions, no visible tattoos. Do you have any tattoos?
No.
Good. Her temperature is warm to touch. No coolness noted. She has good skin turgor, good skin mobility. No moisture noted anywhere. No edema, no swelling. Her nail configuration is adequate. There's no cyanosis or clubbing of her fingernails. And her hair is, her hair quantity is very good. It's distributed evenly throughout her head. There's no areas of balding. There's no areas of thinning. Her texture is smooth and color is brown throughout. So now I'm going to move on to your head. So your head is normocephalic. It's round, no signs of trauma. It is positioned symmetrically on her shoulders and is proportional to her body. Her facial features, there's no involuntary movements. Her facial features are symmetrical and they're placed appropriate on her face and spaced appropriately on her face. Her scalp has no skin changes, no dryness to her scalp. Now I'm going to palpate. No areas of bulging, no areas of depression, and again, normocephalic head. Now I'm going to feel for her temporal arteries. They're palpable. Now I'm going to listen to her temporal arteries with the bell. Hold myself good. Good. Now I'm going to feel your frontal sinuses and your maxillary sinuses. Any tenderness?
Nope.
Good. Any tenderness to your TMJ? No. Open your mouth wide and close. Jut your mouth out or your jaw wiggle side to side. Good. Can you smile? Can you frown? Can you wrinkle your forehead and puff your cheeks? Good. Close your eyes for me. Do all these feel the same?
Yes.
Good. So moving on to her eyes. So her eyes are aligned horizontally. They're symmetric to each other. They're placed appropriately on her face. Can you look up? Her conjunctiva is pink and moist. Can you look side to side? Sclera is white, no jaundice. I'm looking at her upper and her lower lids. Her upper and lower lids, there's no signs of inflammation. There's no signs of swelling. I'm also looking at her lacrimal glands and her lacrimal ducts. No signs of swelling and no excess tearing or any drainage. Now I'm going to feel all around her eyes. Any pain or tenderness?
No.
Feeling over her lacrimal glands, feeling over her lacrimal ducts, and no bulging or masses noted. So now we're going to move on to our eye charts. Cover one eye, please. Read the smallest line. This is 14 inches away. Read the smallest line you can.
5, 6, 3, 2, 8, 7.
Good. 20/30 vision to that eye. Take this card and read this one.
4, 2, 8, 3, 6, 5.
Good. 20/40 vision. Do you have do you wear glasses?
No.
Good. So now I'm going to have you look at my nose and tell me when you see my fingers wiggling.
No. No.
Good. Look right at my nose and follow my finger, whatever it goes without moving your head. EOMs are intact, no nystagmus or lid lag. Can you please turn off the light for me? I'm going to look at your pupils. Okay, now I'm going to do your pupils with consensual reflex. Good. Can you please look at my finger and look at the wall behind me and look back at my finger? So pupils are equally reactive and responsive to light and accommodation. So with the lights off, I'm going to take a look at her eyes. That's zeroed out. Good. So look straight ahead. Look straight ahead, and I'm looking for the red reflex. No opacities block my view. I'm going to come in and zoom in. I'm looking for the optic disc, which is well demarcated margins, and her retinal arteries and veins were visible with no lesions. And the same thing on the other side here. Look straight ahead. Red reflex was seen. Looking for the yellowish orange structure of the optic disc. Well demarcated margins. Same findings to the left eye. So now we're going to move to her ears. So her ears are aligned appropriately, they're positioned on her head appropriately, and they're symmetric to each other. Now I'm going to test your tenderness and mobility. Does this hurt?
No.
Does this hurt?
Nope.
Any tenderness?
No.
Any tenderness?
No.
Great. So now I'm going to whisper something in your ear and repeat it once you hear me.
ABC 1, 2, 3.
Perfect. On to the other side.
ABC 4, 5, 6.
Perfect. Now we're going to move to the Weber test. I'm going to ding this. Put it on the back of your head here. Do you hear the vibration evenly in both ears?
Yes.
Perfect. Now I'm going to ding this and put it behind your head. When you stop hearing it, tell me.
Now.
Do you still hear it?
Yes.
Perfect. To finish the Renee test, I'll do it on the other side. Please tell me when you stop hearing it.
Now.
Good. Do you still hear it?
Yes.
Great. Now I'm going to look into her ears. Okay, I'm going to pull her ear up. No drainage to the outside and no drainage on the inside. Her ear canal is clear, no obstructions, and her eardrum is pearly gray, and conal light was visible. Do the same thing on this side. Okay, ear canal, no obstructions, eardrum, pearly gray, same findings. So now I'm going to take my little speculum off, to her nose. So upon initial inspection, her nose is midline, no deviation to her septum. Take an alcohol swab here, and can you cover one nostril and take a deep breath in? Good. Cover the other nostril and take a deep breath in. Good. 2 questions. Could you smell the smell evenly to both sides? And 2, could you breathe evenly to both sides? Great. So olfactory nerve is intact, and so is patency. So now I'm going to look into your nose. I'm looking in your nares, I'm looking at the turbinates, I'm looking at the septum. Septum is midline with no perforation or deviation, no drainage, polyps, or crusting to her nose. Now I'm going to move on to her mouth. So upon initial inspection to her mouth, there's no ulcers, her lips are pink and moist, and there's no signs of cyanosis. Can you open up for me? Good. So buccal mucosa is pink and moist, buccal mucosa is pink and moist. Can you stick your tongue out for me? And no ulcerations to her tongue, no ulcerations to her tongue or any part of her mouth. Her teeth are white, no teeth are missing. Her gingiva are pink and white, gingiva are pink and white. Can you stick your tongue out? And say, ah. Good. I was looking at the soft and hard palate. The soft palate rises and falls symmetrically. The uvula remained midline, and the tonsils were not red or swollen, and her voice quality was strong. Can you stick your tongue out? Can you move it side to side? Good. And can you swallow for me? Good. Vagus nerve, hypoglossal nerve, and glossopharyngeal nerve were all intact. Now I'm going to move to your neck and lymphatics. When I'm looking at your neck, I'm looking for the fullness of your neck, the contour of your neck, the mobility of your neck. Your neck is supple with no stiffness. There's no skin folds, there's no masses, there's no webbing. It's symmetrical on either side, and your trachea is midline. Now I'm going to feel your carotids. Good. +2, +2. I'm going to listen. No bruit. No bruit. Now I'm going to feel your lymph nodes, starting with your anterior cervical, going to your posterior cervical, going to your supraclavicular, going to your preauricular, to your postauricular, to your occipital, to your tonsillar, submaxillary, and submental. Perfect. Now I'm going to feel your trachea. Again, your trachea is midline, and the space between your sternomastoid and your trachea is symmetric. Now I'm going to come around here and feel for your thyroid. Can you take a deep swallow? Good. Your thyroid rises symmetrically. Now I'm going to displace off to the left and palpate for your thyroid. Displace off to the right and palpate for your thyroid. No enlargement, no masses, no goiters. Can you put your chin to your chest and lean all the way back, off to the side, look to the side, and look to the side, and shrug your shoulders. Perfect. Moving on to your musculoskeletal. Please stand up. Posture is erect. I'm looking at the alignment of her extremities. No extremity is longer than the other. I'm looking at any edema around her joints. There's no edema to her joints. There's no changes in skin color. There's no pigmentation changes. Her muscles are symmetric to each other. No atrophy. Can you take a quick walk over here and a quick walk back? Gait is steady. No changes to gait. I'm going to look at the back of your neck. I'm going to palpate your cervical spine, your thoracic spine, your lumbar spine, and your iliac crest, and your paravertebral. Can you bend forward for me? And her spine is straight. All right, we're going to do a little bit more range of motion. Bend backwards, side, side, rotate, rotate. Full range of motion. You can have a seat. Now I'm going to look for tenderness, crepitus, and pain at the rest of your joints, starting with your clavicle and your shoulders. Please let me know if there's any tenderness. Any tenderness yet? Good. Then we're going to move to range of motion. Out, up, all the way back. Out, up, up, there. Now touch your opposite shoulder, behind your shoulder, behind your shoulder. Scapula, scapula. Shrug your shoulders. Good. Stick your arms out. Don't let me push. And push me down. Good. I'm going to feel your elbows. You can bend your elbow. Let me know if there's any pain or tenderness. I don't hear any crepitus. Flex your arms out. Flex your arms in. Put your hands like this and flip over. Pull me in. Good. Push me out. Good. I'm going to feel your wrists. Any pain or tenderness?
No.
I'm going to feel your hands and your fingers. I'm going to feel your wrists, your hands, and your fingers. We're going to do some range of motion. Wrists flat, up, down, in, and out. Hands like this, over. Wiggle your finger. Put your thumb here. Don't let me pull. Good. Flip back over and don't let me push in. Don't let me push in. Don't let me push in. Squeeze my hands. Good. Cock your wrists. Don't let me pull. Push. Good. Now we're going to feel for your hips. Any pain or tenderness? I'm going to trace it around. Trace it around. So please lay on your left side here. Flip over for me. Good. Iliac crest. Any pain or tenderness? Over to your bursa. Good. Please lay on your back. Good. I'm going to place my hand behind your back. Bring your knee to your chest. Good. And straighten out. And all the way off the bed. Good. Keep it straight. And bring it across your body. And across way over here. Now bend your knee in. And rotate your hip in. Good. Just like that. And rotate your hip out. Good. Now push down on my hand. And push up. Good. Push in, push out. Perfect. Now can you put your right side right here? Yep. Perfect. Feeling down her iliac. Any pain or tenderness?
No.
Good. Lay on your back for me. We're going to do the same thing. Knee to your chest. Good. And straighten out off the bed. Good. Keep it straight across your body. Ray over here. Bend at the knee. Rotate your hip in, rotate your hip out, push down on my hand. Good, push up. Perfect. Lay right there. I'm going to feel for your quad muscles. Moving into the knee. Any pain or tenderness anywhere? No. Moving to the knee. Okay. Bend your knee up, kick up towards the sky, and back down. Good. Put your hand or knee right here. Rotate your knee in. Good. Rotate your knee out. Good. Press down. Pull back up. Good. Bend your knee, all up, down, and then rotate your knee in and rotate your knee out. Push up and push down. Good. Ankles. Any tenderness to your ankles, Achilles, your heels?
No.
Ankles. Achilles or heels?
No.
Good. Point your toes towards me. Point your toes towards your nose. And externally rotate them out. Good. And internally rotate them and externally rotate them again. Pull up towards your nose. Push down towards me. Good. Now you can sit up. Can you tell me your full name?
Marina Ross.
And where are we right now?
Springfield, Virginia.
And what year is it?
2016.
And recent memory, what was our appointment time today?
10:30.
Good. And remote memory, when is your birthday?
10/20/1987.
Okay, see if you can get this question for me. Repeat the or finish the sentence. The squeaky wheel gets the,
Greece.
and what does that mean?
A lot of people gets the attention.
Very good. Let's count backwards from 7.
7, 6, 5, 4, 3, 2, 1.
Perfect. Now we're going to go into cerebellar function. So you're going to tap your hands really fast. Very good. Perfect. So now you're going to take your pointer finger, touch your nose, and touch my nose. Good. Do the same thing with this one. Okay. So now there's no involuntary tremors at rest. Point up towards the sky and touch my finger and hold. Do the same thing with your eyes closed. Perfect. Now this hand. Good. With your eyes closed. Good. Keep your eyes closed for me and tell me which way your toe is pointing.
Down, up, down. Up, down, down.
Keep your eyes closed. I'm going to do the same thing with your finger.
Up, down, down. Up, down, up.
Good. Can you stand up for me with your ankles touching? Good. Keep your eyes closed. Very minimal swaying. Romberg test is intact. Can you walk this way, heel to toe? Good balance. On the way back, walk on your tippy toes. And now on your heels. Good. Have a seat for me. Okay. Close your eyes for me and tell me if this is sharp or dull.
Sharp, dull, sharp, dull, sharp, dull, sharp, dull.
Okay. Now keep your eyes closed and tell me when you feel it.
No, 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 no,
Mm-hmm.
no, no.
Good job. You can open your eyes. I'm going to ding this and put it on your finger. Tell me when you stop feeling the vibration.
No,
Good.
no.
Okay. Or you still felt it when I touched your shoulder? Good. I'm going to put this on your finger. Tell me when you stop feeling it.
No.
Good. Do you still feel it a little bit?
Yeah.
Good. Okay. Close your eyes for me. I'm going to put an object in your hand. Feel it and tell me what you feel.
Coin.
Good job. I'm going to put another object in your hand. Keep your eyes closed. Feel it. Tell me what you feel.
Small coin.
Perfect. Now I'm going to feel your reflexes, starting with your brachial reflex, or your bicep. Put your hands like this. For your tricep reflex. Tricep reflex. Brachial radialis. Brachial radialis. Relax your leg in my hand. Good. For your patella. Good. Down to your Achilles. Down to your other Achilles. And lastly, plantar reflex. Our toes curl in and reflexes were intact. Thank you. That concludes my exam.